Good afternoon. You are with the big story here. I'm Seher Zama. Let's make a start with the new classifications now that have come in from the Union Health Ministry. Remember, we've been looking at zones being identified as red, orange and green zone. These classifications are further going to be upgraded on a weekly basis in each given district. The government here says this is going to be based on the doubling rates that have been seen in these areas, and this color coding of districts will also help ease in lockdown in zones which are not severely hit by the corona crisis. This is post the 3rd of May. The centre, though, has stated that the classification list is dynamic. It is, of course, going to be changing on basis on the number of cases that keep changing on a daily basis. But this list of color coding is going to be upgraded now once every week. Our correspondent Ayushman is getting us further details here on this. Ayushman, is this going to be a more frequent upgrading? Because we have seen this happening where districts are colouring out areas which are intensely hit or which haven't had a case in the past 14 days or the 28 days. That is how the gradation has been done as per green, red and orange. What is new about this new announcement then?
Well, sir, this is for the next week, post May 3rd. This is the gradation that the Health Ministry has classified. And as per this, as per the earlier number, we had 170 districts in the red zone. Now that number has come down. We have only 130 districts in the red zone.
Okay.
And currently 284 districts are there. So 7 more districts have been added there. Earlier it was 207, and now 284 districts are there in orange zone, and more than 300 districts are there in green zone. That means there are no cases reported in past 28 days. Now, sir, the method which has been used here is the number of cases doubling, the caseload that is there with the districts, and also the hotspot and the containment zones, the number of testing that is being done. These are all the criteria which the health ministry undertook, and then they have decided that this is the number. Currently 130 districts in India are there, with UP having 19 districts and Maharashtra having 14 districts. All 11 districts on the national capital are there in the red zone. So clearly these are the districts which will see restrictions implemented, even if the government decides not to extend the lockdown. But for now, definitely this is the data for the coming week post May 3rd.
All right, so this is going to be for the coming week post May 3rd, and this gradation is going to be important, as you said, Ayushman, for lifting of the lockdown. If that entirely takes place, this is going to be how this is going to be categorized. Thank you for getting us those inputs. Let's now switch focus on what's happening in the national capital here in Delhi. We are recording 3 more deaths and 76 new cases that have been reported in the past 24 hours. Remember, Delhi, which was looking at 100 cases reported per 24 hours. So this is marginally down of 76 new cases, but the death toll that continues to climb as well. Total number of cases in Delhi now that are 3,515. This is only Delhi. 59 people have succumbed to the virus. That is the total death toll here. The Delhi government has now ordered screening of all people who are living in the COVID containment zones. Remember, Delhi has one of the largest number of containment zones. At present, there are around 100 containment zones in the national capital. The government, of course, says this is because they have been testing maximum. Which is why they have come about this calculation of which are the zones that need to remain in containment. There are around 100 containment zones in the national capital. Delhi government is now also taking more measures. Remember, each of the respective state governments are headed towards preparations post May 3rd based on the central government's announcement. Even if there is to be a graded exit plan, what all measures need to be kept in mind. So the Delhi government says it is ordering the screening of all people that are living in the COVID containment zones. And these are a total of 100 containment zones that we're looking at. Let's get in further details. Our correspondent Alok getting us those inputs here. Alok, is this the first of its kind that we're seeing coming in from a state government, that as far as containment zones are concerned, everyone, irrespective whether you have symptoms or you're asymptomatic, or whether you haven't had a primary touch with a positive person. If you're living in a containment zone, you will be screened.
Yes, absolutely. It is very important decision that the government has taken, and they want to just get the confirmation that nobody is staying in the containment zone left without any kind of test, and that is why they are now going to start screening everybody that who are staying in the containment zone. Remember earlier when those persons who comes under the category of contact tracing, they were only being screened, but now the government has decided to whatever whosoever is staying in these containment or hot spot zones, they will be screened. Remember, in Delhi, as of now, 100 containment zones, and in fact, all 11 districts are announced by the Delhi government as the hot spots. So definitely, the risk in the national capital is very high. In fact, the bordering districts have also sealed their borders so that the movement from the Delhi could be stopped because they have blamed the national capital that the number of cases increased in their district is just because of the Delhi. As of now, if you particularly talk about the precautions the Delhi government is taking, they are doing the screening, and also they are doing the sanitization work in all the districts, in all the containment zones as well. Number of cases are increasing at every day. 3,500 cases have already reached. But important aspect in Delhi is also that we need to keep in our mind that because of the Marcus, where there was event happened, and as far as the Delhi government figure is concerned, more than 1,200 persons from the Marcus were affected because of the corona. So this 3,500 persons who are now become positive, of them more than 1,200 are from Marcus. So there's a huge quantity of persons from Marcus only who are the outsiders. They got affected. That is also very important aspect as far as the Delhi is concerned. But we hope that whatever the measures the Delhi government is taking, they will it will more a fruitful result.
All right, Alok, many thanks. You mentioned the markers there, of course, called super spreaders. Now they're the maximum number of donators as far as requirement for plasma therapy there is concerned. That needs to be remembered as well. Let's get in further inputs. This is details coming in from the city of Mumbai now. 415 new positive cases. Remember, out of our big cities, big metros, Mumbai is the worst hit with the maximum numbers that we're seeing. 20 deaths that have been reported in the last 24 hours itself. Total number of cases in Mumbai has crossed the 7,000 mark as we speak. 290 people have already died because of COVID. Doubling rate though, as the calculation that keeps coming in from the central government, the average doubling rate that has slowed down. So even in Mumbai, even though it's looking at a huge spike in cases per daily basis, the doubling rate has stretched to 10 days. Case fatality has also decreased, which was earlier 6.3%, has now come down to 3.9%. More preparations that are on by the city administration here in conducting continuous disinfection, screening and testing within the containment zones here, which is to curb the spread. Our correspondent Disha getting us further details here. Disha, if we analyze the doubling rate, the recovery rate, vis-a-vis the newer number of cases that we keep getting in on a 24-hour basis, does this mean that things are changing on ground or beginning to look marginally better?
Well, as far as Mumbai is concerned, we certainly cannot say that things are getting better here, because if you count the total number of positive cases in Mumbai, it is alone over and above 7,000 cases. And if you talk about the entire Maharashtra, then the cases are over 10,000. So you can see that Mumbai accounts for 70% of the total positive cases in the state of Maharashtra alone. It is one of the red zone and hotspot city. And the BMC says that this is because the cases are increasing is because due to higher testing. So far, the BMC has managed to test 49,000 people in the city of Mumbai, and that is why we are looking at everyday spike in the cases, and most of the cases now are the contact cases. And BMC says that the worst affected areas have always been the Worli, Byculla and Dharavi, which consist of slums as well, which consist of SRA buildings as well, and which consist of chawls as well. Now, maximum cases are being reported from these areas, and that is why contact cases, and that is why door-to-door slum door-to-door survey in the slums, door-to-door screening of people in the slums, and specifically focusing people above 60 years of age is on the priority as we speak, Seher, because every day what we are looking at is increase in the numbers, specifically Dharavi, as we all know. Till date, 65,000 people have been screened so far, out of which Dharavi has reported 369 positive cases. And even as we speak, the door-to-door screening is still going on. So certain measures are now being taken by the BMC. Of course, as we all know, that the doubling rate has come down, and this is of course a good sign, from 8.3 days to 10 days now. So the doubling rate has come down. If you talk about the death rate as well, that has come down from 6.3 to 3.9. However, it is closer to the national average, which is 3.1 at this point in time. So a lot of measures are being taken. Of course, there are about 805 containment zones in the city here. The city is being divided into red zones, blue zones, and orange zones. Most of the cities, most of the areas are in red zones as we speak, where completely people's movement is restricted. In slums, mostly, and chawls, only for public toilet usage, people have to step out. Otherwise, everything is being given to them door to door, so that people do not really step out. People
Okay.
are also institutionally quarantined as we speak, Sir.
All right, Disha, thank you for getting us those inputs coming in from the worst affected metro, Mumbai, here on how those numbers continue to keep climbing up. These are further details coming in Ahmedabad. Remember, Ahmedabad, a city which has seen a sudden spike in cases. 3,000 mark that has now been crossed in the city of Ahmedabad. Detection of 249 cases done in the past 24 hours itself. The death toll has risen further to 149. In Ahmedabad, total number is currently, as we said, is beyond 3,000, which is 3,021. The city alone accounts for nearly 65% of the total cases and 70% of total deaths that we've seen across the state of Gujarat. Yes, these are breaking inputs coming in. This is yet another case of how social distancing norms that are being flouted yet again. This is coming in from Ghazipur, which is in Delhi, in the national capital. This one coming from Ghazipur wholesale market. Crowds that continue to throng. This is to take stock of fruits and vegetables. These are the images up on your screen. Remember, the Delhi government has been very mindful of maintaining social distancing norms even at Sabzi Mandi is concerned. We have seen how the main Sabzi Mandi was shut down. Temporary was arranged in another location, but this is in Ghazipur. Once again, social distancing norms that have completely been thrown off the window. A massive gathering of people coming in for vegetable and fruits. Our correspondent Alok is getting us these details. Alok, as you've been covering this in all these weeks and also pointing out how the Delhi government has time and again imperatively said that these are social distancing norms that need to be followed at Sabzi Mandis as well, but not so in what we're seeing in Ghazipur today.
Yes, absolutely. In fact, earlier we saw that in Sabzi Mandis, social distancing was not being followed, and just because of that, Asia's one of the biggest Sabzi Mandi that is located in northwest Delhi, Azadpur Sabzi Mandi, there was restrictions were put in place in that place. In fact, one day the Mandi was also shut just because of this whole kiosk was happening. Later after that, the government decided to change the timings of these sabji mandi, but the kiosk was still happening. But now the sabji mandi is open with the complete restriction deployment of police personnel over there. But if we talk about Ghazipur Sabzi Mandi, which is located in eastern part of Delhi, there if you see the video, there is no deployment of police as well. The people are coming with the baggages, with their luggages in their hands, and they want to buy the items, but and they are waiting for desperately that to open the gate and just to go inside, and there was no following of the social distancing. You can clearly see in the visual. So definitely the government should take cognizance of that. The deployment of police personnel, the deployment of forces should be there, so that the people who are coming to buy the vegetable items in the morning, they should follow the social distancing.
All right, Alok, many thanks for getting us those details. On that note, we're slipping into a very tiny breather, but please stay on with us. We're back in just a bit. Mumbai civic body has now asked all its employees to report to work, and they're not looking at half a capacity. They have said that this is reporting to work in full 100% attendance, which is going to be compulsory. This is both in office and on field. Some relaxation that has been given only to the senior employees who are above 55 years of age. They have been advised to continue working from home. Our correspondent Disha is getting us these details here. Disha, given that Mumbai has been one of the worst affected metros in the country, with a continuous rise in numbers, BMC has been taking those precautions. Why the sudden instruction to be at work in 100% capacity?
Well, Seher, the only reason that the BMC is saying at this point is due to increase in the number of cases. They need the full staff to be present to tackle any sort of situation that really prevails here in the city of Mumbai. Remember that till today, the BMC used to work with only 50% of its staff capacity. But now, keeping in mind the rising number of cases, this is what the BMC has decided, that all 100% attendance has to be done as far as the staff is concerned. Only people above 55 years of age with medical conditions, they are allowed to work from home for the period of 2 weeks. But apart from that, people who are staying in outskirts like Thane or Kalyan, Dombivli areas, they have to report to the nearest ward office if they cannot really report to the main headquarter. So these are certain, of course, measures, guidelines and rules that BMC has put in place, and this of course starts from tomorrow. 100% staff is mandatory in the BMC offices, ward offices as well as headquarters.
All right, Disha, please stay on with us. We're getting in further details here. This is a case now coming in from Gujarat. Take your inputs on that as well. Local residents have attacked policemen. This is yet another case of police being attacked that has been reported from Gujarat. Earlier, we had reported one from Surat. This case coming in from the Godhra area, part of a cluster containment drive that was going on with the police taking into account how containment zone needs to be handled here. A police inspector has sustained minor injuries. Stones were pelted by the residents as well, and the police then had to resort to firing tear gas shells to control the situation. Disha is getting us further details here. Disha, this is shocking because even in this case, at the end of the day, the police doing its job in maintaining the norms of the containment zone, and yet they get attacked.
And this is, of course, the third such attack on the policemen in the state of Gujarat in the last 4 days. First two incidents happened in Surat, and this, of course, has happened in a new area itself in the city of Ahmedabad in the state of Gujarat. And as we all know, Gujarat is also every day seeing the rise in the cases. And keeping this in mind, of course, this was one locality where in the last 2 to 3 days, more positive cases were coming to light. And that is why it was important for the police to seal the entire area and to actually declare it as a containment zone. And when few police officials reached the area, a lot of locals gathered around. They protested their move. They said that the area cannot be sealed as there are no positive cases. And in that entire chaos, the locals started throwing stones at the policemen, and one policeman also got injured. He has sustained minor injuries, is what we understand. So to control the mob, to control the crowd, the police had to finally resort to actually firing tear gas shells, is what we understand at this point in time. It took at least 2 hours for the police to control the entire situation. The government of Gujarat has taken this matter very seriously, and further investigation is underway.
All right, 2 hours to control that situation, violence there, as you say, Disha. Thank you for getting us those inputs. Let's now get you details coming in from Bengaluru, and this is once again regarding the migrants crisis. Around 2,000 people who've been living in the migrant colony there in Bengaluru who haven't had a job or income of the past 40 days. They're managing to eat, but they're finding it difficult to sustain and continuing to sustain their families. Remember, there is no income, there is nothing that they can send back home. Some labourers have appealed to the Bihar government, Bihar Chief Minister Nitish Kumar, to help them return to their native state. Remember, Bihar has largely been reluctant in reacting to those appeals that have continued to come in. Here's a report that's coming from our correspondent Deepak Bopanna. Let's take a look.
We're standing here in one of the migrant colonies in Belandur, where about 2,000 to 3,000 migrants are staying. Most of them, of course, who work at construction sites as painters, as plumbers, as electricians, as laborers, and some of them as security personnel. Now, most of these people here have been out of jobs for the last month or so, and of course they've been hoping that some of them could even get back to their hometown, but things have not been easy. But of course, now with the new relaxations coming to the fore, it has come as a welcome relief. Let's try and speak to some of them to understand what are the main problems. आप बता सकते हैं कि आपके जो कॉलोनी में है कितने लोग रहते हैं और क्या-क्या समस्याएं हैं?
हमारी कॉलोनी में 1000 आदमी रहते हैं और इसमें खाने को तो थोड़ा बहुत कुछ मिलता है और पानी का प्रॉब्लम है। एक नाला, एक कुआं है, उसमें हम सब लोग मिल के नहाते हैं। जैसे 200 आदमी इसी में रहते हैं, तो इसमें 200 आदमी एक ही गड्ढा में नहाते हैं हम लोग। ये प्रॉब्लम है और गंदा भी रहता है।
और आपको करेक्ट टाइम से यहाँ रेशन सब मिल रहा है आपको सबको, और प्रॉब्लम कुछ हो रहा है इसके बाद?
मिलता तो थोड़ा बहुत कुछ मिलता है और प्रॉब्लम भी रहता है।
सर, मैं तो यही निवेदन करना चाहूँगा सभी मीडिया वाले से और अपने बिहार के चीफ मिनिस्टर नीतीश कुमार से, यही कहना चाहूँगा कि हम लोगों को यहाँ आने का बेंगलुरु के बेलंदूर में टीसीआर कंपनी में आके 1.5 माह 3 महीना हो गया। लॉकडाउन के दौरान हम लोग जो भी मिलता है राशन पानी तो ठीक ही है गवर्नमेंट का, लेकिन एक भी रुपया हम लोग को नहीं मिला है यहाँ पर। 1.5 महीना हो गया, 1.5 महीने का मजदूरी 20,000 रुपया होता है, 1 रुपया तक नहीं मिला। हमारा परिवार भूख से मर रहा है वहाँ पर गाँव में। हम बिहार के किशनगंज जिला कोचाधमन थाना और पंचायत महोदय के रहने वाले हैं। सर, हम लोगों से, आप लोगों से यही निवेदन है हमारे बिहार सरकार नीतीश कुमार से, हम लोग को घर भेज दिया जाए 2-4 दिन के अंदर।
Well, that's the main concern here. Though they are managing with, the relief material that's coming in from, be either NGOs or the politicians, the concerns that most of them are raising is that they have to send back money to their families who live in their natives. They're not able to do that, and they're hoping that as soon as possible they will be able to either go from here to support their families back at home, or at least start getting a job which will be able to pay the needs of their family members.
All right, on that note, it is a wrap on the show. News and updates that continue for you right here. Stay on with us.